Hello, everyone, and welcome. My name's Shannon, and I am a registered dietitian specializing in maternal care. Mother of Fact is a telehealth platform providing evidence-based nutrition care from registered dietitians for women from pre-pregnancy and fertility, throughout pregnancy, postpartum, and beyond. We specialize in high-risk nutrition intervention and care and work primarily with birthing people in resource-restricted communities. If you have questions about Mother of Fact, who we are, how we work with patients and care teams, I'll drop my email address in the chat and you can reach out after the webinar with any questions or concerns. Before we get started, just make sure that you keep your microphone on mute. Feel free to put any questions into the chat box and we will make sure that we address them at the end of our session. And please, feel free to put your video on if you feel comfortable. This webinar is part of our free educational series, and we'll be sharing details about the next April webinar at the end of this session. And if you can't stay for the full session or would like to revisit today's content, we will be able to have this recording posted on YouTube and shared out with everyone after the meeting today. So please welcome to today's session. The topic is gestational diabetes, prevention, screening, and what to expect. We're excited to dive into this conversation and share practical, evidence-based guidance you can actually use. So our presenter today is Abby, who is a registered dietitian specializing in prenatal and pediatric nutrition. She has always loved nutrition but wasn't sure where to focus in her career. Then she was sought out by a young mother during her time as a health coach at her university. That experience sparked a clear purpose. Supporting moms and their children is where she could make the biggest difference in the world. After spending 2019 in Ecuador learning Spanish, Abby is also passionate about serving moms and babies in their native language and within their own cultural customs. Just last year, she became a mother herself and truly relates to the challenges moms face when caring for her own health along with other families. We're so grateful to have her part of the Mother of Fact team and excited for her to share her expertise with you today. So, Abby, I will turn it over to you.
Thank you so much, Shannon. I'm so glad you all are here to learn about gestational diabetes. We're going to talk about the prevention, screening, what to expect. Little disclaimer, I am getting over a cold, so just bear with me as my voice is not working the same as it normally does, but we're going to push through. We're going to do this. So just a little overview, what we're going to talk about today. Understanding really what gestational diabetes is and why it develops and how it's diagnosed. Maybe you've been diagnosed with it, maybe you're not, maybe you're worried about it. So we're going to talk about that. We're going to talk about common risk factors. So what puts you at risk for possibly getting the diagnosis in the future, and realistic strategies to help possibly lower that risk. We're going to talk about food, obviously, learning how to manage your blood sugar, making sure your baby in your pregnancy is as healthy as possible. And we're going to talk about smart snacking and craving because we believe that everything should be realistic and you don't have to give up your favorite foods and just totally change your diet completely in order to avoid spiking your blood sugar. And then, of course, we're going to talk about myths and misconceptions because there is a lot of misinformation about gestational diabetes. Lots of people don't know exactly what it is. There's a lot of fears about it. So we're going to talk about that and hopefully help you out there. So first, what is gestational diabetes? Maybe you know already, maybe you don't. But gestational diabetes develops during pregnancy if you did not have diabetes before your pregnancy. So if you did, it would just be diabetes. It affects how your cells use the blood sugar, which is called glucose. It can impact your pregnancy and your baby's health. There are more risks associated with it, which we'll talk about in the future. But that is not to be worrisome for you. So gestational diabetes develops when you can't make enough insulin during your pregnancy. So insulin is something that we all should have, and while it's working properly, our cells are able to get the energy that they need to do their proper functions throughout your whole body. I like to think of insulin as like a key because if you imagine your cell like it needs to be open to have the nutrients in, to have the sugars in so that it can use it all, do its functions. And so when insulin is working, you can just use the key and open the door. But when it's not working properly, then you can't really open the door because you don't have the key. So the cell stays closed, and then the sugar just kind of develops. It just grows more in quantity, and it's in your bloodstream. It can't really go anywhere because there's no doors open for it to go into. So that's kind of just how I like to think about it, as insulin is a key, because it is confusing. There's a lot of vocabulary if you're not familiar with this. But basically, it is caused, there's a lot of causes to it, and we don't know exactly how it happens or why it happens in some cases. It can happen because there's a lot of hormonal changes going on during pregnancy, especially from the placenta. The baby is having to make their own and develop their own insulin, develop their own blood sugar levels, and that can also impact the mother, of course. And so it's also called insulin resistant sometimes. It's just another term that we use. And so it's kind of like anti-insulin. So it just, your body needs more insulin when it's insulin resistant because it's not able to use it as well. So this causes high blood sugar, like we talked about. And so we're able to test your blood and see how much sugar is in there, especially after you eat. Um, that's how we can tell if somebody has gestational diabetes or not, because their blood sugar will be a lot higher than normal. And just so you know, it is not your fault. There's so many moms that have guilt, like I did this from something that I ate or didn't eat during my pregnancy or before my pregnancy, but it's just something that sometimes happens. And so we do not need to feel any guilt about this. And we have lots of resources. If you get the diagnosis, or if you don't, or if you have risk factors, there's ways to control that so you can have the best possible outcome for you in your pregnancy. So let's just talk a little bit about the screening and diagnosis timeline. So if you have a lot of risk factors, or if you have pre-diabetes, sometimes your doctor will want to screen you early. So if you're like in a high risk pregnancy, and so they might try to screen you early, like maybe in your first prenatal visit. But most of the time, it will happen between 24 and 28 weeks of pregnancy. Most people will be screened, and the most common glucose test is you just drink a certain amount of liquid that has a lot of sugar in it. There's a lot of people that say it's disgusting, or they threw up after it, or they feel really gross. But there's a lot of people that say they didn't really mind it, just kind of tastes like soda, or that they didn't really feel gross after. So a lot of people also have the question of, is this bad for my baby to consume that much sugar for this glucose test? And obviously, it's not something that we want to do all the time, every day, every week, or every month of your pregnancy. But it is important to be able to know if you have gestational diabetes. And so it is necessary. And right now, it's really the one of like the only things that we can do to test for gestational diabetes is just consume a ton of sugar and then test your blood sugars a certain amount of time after. So it is important that if you haven't done this screening yet, um, then you follow all the directions. So if it tells you not to eat, then you don't eat, and you make sure to get to your appointment on time. You time everything right. You drink the drink in the right amount of time, so that I can get the most accurate results. Because we don't want to mess with the results. We need it to be as accurate as possible. So post-diagnosis management. So if you are diagnosed, you'll work with your healthcare team to adjust your blood sugar. You can do nutrition adjustments. We'll talk about movement, probably exercise. Sometimes medication is needed, but we kind of want to avoid that just due to the pregnancy. But we just want to make sure that you and your baby are the most healthy that we possibly can. So common risk factors. So how do I know if I am or you are at a risk for gestational diabetes? Even if you don't have any of these risk factors, sometimes you can still develop it. So it's just what we've seen from the research, some things that are correlated with getting gestational diabetes. But it doesn't mean that you will, if you have these risk factors, that you will get gestational diabetes. especially if you do some work to manage it and prevent it. So we've seen that people who have a body mass index above 25 before pregnancy tend to have a little bit higher risk for getting gestational diabetes during pregnancy, especially also family history. So if you have a parent or a sibling, because it's direct relationship with type 2 diabetes or gestational diabetes in a pregnancy, then you are more likely to get it as well. We've also seen that being over the age of 25 is also a risk factor, which is crazy because I feel like 25 isn't that old. We've also seen that having more African American, Hispanic, Asian, or Native, or being a Native American descent can also just, these people tend to have a little bit higher percentage of a risk of developing gestational diabetes. We don't know why, but that's just what we've seen in the research. And medical history, such as PCOS, or if you have insulin resistance or prediabetes before your pregnancy, we've just seen that also correlates to getting it a little bit higher of a chance. So let's talk about just some tips that we can do to possibly prevent gestational diabetes. It isn't always preventable. Some people do all these things and they still get it, and that is just the way it is. But we want to be as healthy as we can just to reduce the risk as much as we can, reduce the complications. So one thing you can do, which is pretty effective, is focus on balanced meals. So combining your carbohydrates, which are like whole grains, beans, fruits, and vegetables, those are the fiber-rich carbohydrates, with lean protein and healthy fats, because your blood sugar is like a line. If you eat, it'll go up no matter what, and if you don't eat, it'll go down. But if you do have gestational diabetes or diabetes in general, sometimes it just spikes a lot, drops a lot more than it should. So we want to keep it as level as we possibly can, preventing these spikes and drops, so that your energy, everything just kind of feels the same. Because you feel kind of bad or you just feel crummy if your blood sugar is really high or really low. And that's when you can impact your baby as well. So focusing on these balanced meals, we can, if you think about your plate, I want you to think about what you ate for dinner last night. It might take a little bit because I don't even know if I remember what I ate. But just think about that. Think about what your plate looked like or your bowl or whatever you were using. Um, and I'm sure even mine was not as perfect as it should have been. But if you think about a plate, you want to think about half of that plate being full of fruits and vegetables. That's like a lot more than most people are used to. And then the fourth of it, like your proteins, and a fourth of it, your whole grain or your starchy carbohydrates. So I know is if you can get it as close to that as possible, that's the best possible thing. And that's how you can get a balanced meal. So you're not eating too much of one thing. You're getting nutrients that your baby will need and the fiber that'll slow down those spikes. One other thing you want to do when preventing gestational diabetes is to eat regularly. So we don't want to fast for long periods of time. Even 3 and 4 hours is getting close to when you should be eating again. So always make sure you have snacks if you leave the house, so you have a lot of plans if you'll be busy. I've had someone set alarms on their phone so they don't forget to eat, because if you do forget to eat, sometimes your blood sugar will go down, which is not what we want, and then it'll tend to go high if you do eat something. So we just want to keep it as normal as possible by eating every 3 to 4 hours, and make sure with you when you are packing snacks, and utilizing small meals or something to keep you eating regularly, that you use protein or fiber-based snacks. And so this goes along with the next point, which is to choose carbohydrates wisely. So if you know the difference between refined carbs, and our complex and simple carbohydrates, we want to go with more of the complex carbohydrates, which have more nutrients, like oats, lentils, quinoa, sweet potatoes. Those have more fiber, more nutrients, rather than the refined carbs with the sugars, like sweet drinks, pastries, or white bread, things that don't have a lot of nutritional benefit and don't have a lot of fiber in them. And then a fourth point that actually really does help is staying active. So this will not only prevent gestational diabetes, help you manage it if you do have the diagnosis, but I promise it will help you feel better overall. I think the hardest part is starting, especially during pregnancy, if you have low energy or you're feeling nauseous or your back hurts or it's just you feel so different during pregnancy. But I promise as you start going, you'll feel better if you get 30 minutes of moderate movement daily. And this can look different for everyone. This can be like cleaning your house. That is being active, going for a walk, things like that. Yoga, swimming. Swimming is so good on your joints. It feels a lot better than other exercises. Of course, listen to your body. If you're having a lot of pain, talk to your doctor about that and make sure you're being safe. But even just going for a short 10 to 15-minute walk after you eat will help you to digest that food quicker and easier, better. And you can significantly lower your blood sugar response. So, movement is so good for us and for our babies. So, tips for preventing gestational diabetes continued. We talked about a lot of tips before, but just a couple more. Supporting healthy weight gain. Just work with your doctor on that. They'll probably tell you if you're gaining too much weight during your pregnancy or not gaining enough. You want to focus on gradual, steady weight gain rather than trying to go on a diet or trying to do anything crazy during your pregnancy or things like that. Just talk to your doctor if you're concerned about that or your dietitian. Prioritize rest and stress management. So it's not always about go, go, go. What else can I do? What else can I get done? But also managing your stress because if you are stressed, your blood sugar can rise. And so I know it is so hard because we have so much going on. If we're managing a household, if there's other children in the home, it's so much. If you're worried about your pregnancy, about birth, it can really impact your stress. So, finding a way that works for you, breathing, stretching, journaling, going outside, spending time with others, trying to really reduce your stress can make a big difference. The next one, kind of hard for some people to do, is not to skip breakfast. This is an essential part of your day to just stabilize your blood sugar and get it going at a good rate. And it's also a great way to get more nutrients throughout your day. So, protein rich. Focus on like eggs, Greek yogurt, something with nut butter, fruit, those kind of things. And then also make sure you're taking your prenatal. There is evidence out there that shows that when you're getting enough magnesium, vitamin D, and omega 3s, then that will lower your risk of having insulin resistance. And it can also help you if you do have insulin resistance. So if you have questions about what kind of foods have magnesium, vitamin D, and omega 3, then we're open to questions at the end. We can talk more about that. And also making sure that these three nutrients are in your prenatal would be very beneficial because it is hard to get how much you need with just your diet alone during pregnancy. So having that prenatal support is great. So managing your blood sugar with confidence. If you do get this diagnosis, or when you do, or if you already do, there's certain things that you'll have to do to be able to check your blood sugars, and we want you to be confident when you're doing that. So the goal is not to just cut out carbs, cut out sugar, cut out your favorite foods. It's just to maintain your blood glucose within a target range. The goal is not to like eliminate the diagnosis and make you like never have gestational diabetes again. Sometimes we can't really do that. So just maintaining your glucose levels, nutrition, making sure physical activity, regular monitoring is what will be really important. So, like we talked about before, carbohydrates are essential for your pregnancy, for your baby's health, for your energy levels. But it is important to recognize what kind of carbohydrates you are eating and when. So you don't want to just eat a meal that has a ton of carbohydrates and then not eat them throughout the rest of the day. You want to have a little bit of carbohydrates with every single snack and every single meal throughout your day. So it just kind of keeps your blood sugar level because carbohydrates are the one thing that does directly impact your blood sugar. Fat does not, and protein does not. So, um, making sure that you're also checking your blood sugar when you need to, especially right after you wake up. That's probably one of the most important ones, and 1 or 2 hours after each meal to make sure you know how your body is responding to different foods because it really does depend on your body. Some people react more to potatoes or more to bread or more to rice than other people. So making sure you know kind of what foods your body reacts to and how can help you develop a routine that will be beneficial for you. And then the power of pairing. So I talked about eating a little bit of carbohydrates at every single meal and every single snack, but also not just eating carbohydrates, but adding protein or fat to the carbohydrates will be very beneficial. It'll prevent these spikes and it'll slow down the sugar absorption, especially if they have fiber and you get all three of those together. So this will help you just to feel more energetic and more in control. It'll protect your baby, it'll protect you, just reduce all the risks. So movement. We know that there is some barriers. We know that there are people who live in unsafe neighborhoods. If you don't have transportation, we're not saying that you need to get a gym membership or pay for expensive equipment or spend an hour every day doing exercise. Focus on what you can do, not what you can't do, because everything that you can do just it does make a difference. So at least 30 minutes of moderate intensity activities most days of the week. Make sure you have that goal. You can do indoor walking. There's a lot of free workouts out there. There's things you can do with a chair. You don't even have to be standing up to be moving your body. And like I said before, cleaning your house, gardening, playing with kids, they count as being active. So that is beneficial for your body and for your baby. So let's talk a little bit about building a like a dinner or a meal. If you were to go out and eat like right after this webinar, what kinds of things should you include? So we'll talk about carbohydrates, protein, and healthy fats, which we've already touched on a little bit. So like we talked about before, just remember the fiber is very important. Making half of your plate, fruits and vegetables is also very important. Some more examples of whole grains or complex carb sources are quinoa, oats, brown rice, whole grain bread, and pasta. There's whole grain pasta out there, or pasta that's made from chickpeas, and I think it's pretty good. So maybe give that a try. It has less carbohydrates and more fiber to help you feel fuller. And then some examples of starchy vegetables and legumes could be sweet potatoes, corn, beans, lentils, and chickpeas. So there's so many examples of carbohydrates, but they won't affect your blood sugar as much as others. So 3 to 5 grams of fiber, you can look on the nutrition facts label and then make sure you're eating an appropriate portion for you. And then we'll do a little dive into protein. It's also called the blood sugar stabilizer. Some examples could be fish, chicken, lean beef cuts, beans, lentils, chickpeas, tofu, edamame. Even peas have protein, which is surprising to me or some people. Eggs, Greek yogurt, cottage cheese, and nut butters. A lot of people, when they're struggling with nausea, protein is one of the first things that's hard to get down, but it is still extremely important. So just try other things. You never know what might make you sick one day. Maybe it'll make you not sick another day. So protein-rich smoothies, there's protein powder out there that is unflavored that you could add to anything really that you're eating or drinking. Greek yogurt or sipping on bone broth could be great options. I've also had people do like French toast because that has a little bit of protein in it and you can hardly taste the eggs or the milk in there. You can add protein powder, different things on there to just add the protein without really knowing it. And then healthy fats, we'll dive into this a little bit here. They are very important for your baby's brain and eye development, and they do not have any impact on your blood sugar. So, not that you can just go out and eat tons of butter and tons of fat, because that will have some negative impacts on you and your baby as well. But at least it wouldn't spike your blood sugar. So, we want to learn how to have appropriate portion sizes for this and pair these with your carbohydrates. So the fats you want to watch out for are trans fats and saturated fats. So you can look on the nutrition facts label. Kind of avoid fried foods and processed snacks. Usually those are the ones that have the trans fats and saturated fats in them. And then embracing the healthy fats, which are like monounsaturated, polyunsaturated. You can read those on the nutrition facts label as well. They do have health benefits. Some examples could be almonds, walnuts, chia seeds, flax seeds, olive oil, avocado oil, and salmon and sardines are amazing for you because of the omega-3s and the protein. Um, Adding avocado, snacking on nuts, using olive oil-based dressings for your salads, sprinkling nuts and seeds on your yogurt, oatmeal, whatever you're eating can be a great way to get those healthy fats in there. Keep it full for longer. Some other just ideas. It is hard to when you get stuck and just eating the same thing every day. So we like to provide just ideas for snacks and meals. So do not be afraid of frozen and canned produce because they don't go bad. So make sure you have those around. They are very budget friendly as well. So like frozen broccoli, spinach, mixed vegetables, canned diced tomatoes or green beans. Also, dairy is a good source of protein and fat. So you can do cottage cheese or cheese sticks. They have that calcium as well. They're just easier to grab for busier days. Canned tuna, salmon, canned chicken, beans and lentils. Look for low sodium options, but those are pretty easy and affordable and nutrient dense. Whole grain crackers, whole wheat tortillas, instant oats. You want to choose the ones that don't have a lot of added sugar to them. But you can always check the labels. Some things will be labeled as healthy, but they will have a lot of added sugar, especially like your yogurt or just some of these processed snacks. So make sure you look on the label, and sometimes they are very sneaky with the sugar that is in there. So just some other ideas for managing blood sugar, because we know life is super busy and we don't want to be out spending hours in the kitchen. Hard-boiled eggs in the fridge. You can grab a cheese stick with a handful of apples or berries. You can add things to plain Greek yogurt to make it a little sweeter, like berries. You can have your soy or almond yogurt with a few seeds. Pre-portioned nuts and seeds or roasted chickpeas are great if you can just grab it on the go. That's a lot easier than making something from scratch or turning to something that maybe not as beneficial for your health. If you are lactose intolerant, there is unsweetened plant-based yogurts out there. Like I said before, make sure to check the added sugars. These have calcium and vitamin D. Cottage cheese are naturally lower in lactose, and they are good protein sources. If you can find some of those cheeses out there, test them out. If you are allergic to nuts, there are other options out there like hard-boiled eggs, like I said, egg muffins, cheese sticks, roasted edamame or chickpeas, tuna or salmon, sliced deli meat with whole grain crackers, sunflower seed butter with celery or apple slices are good options for you. And let's talk just a little bit more about snacking as well, because if you do have these cravings, we do want to honor those. Here's just some more ideas. So feel free to take a screenshot of this, come back to this later if you do need some ideas for some balanced meals, because it is possible to get a balanced meal. It just takes a little bit more thought. Um, and then, of course, we all have food cravings, and a lot of these I feel like can be combated by making sure you're getting enough and energy, um, nutrient dense food throughout the day. Because if you're not, you do need a little bit more calories throughout the day. especially if you're in the second or third trimester of your pregnancy or breastfeeding, and your body will tell you that you haven't eaten enough by craving these things. And so making sure you're eating enough, I feel like, is one of the best ways to kind of combat these cravings. But when you do have these cravings, it is okay to give your body what it wants. But just being mindful about how much you are eating and maybe pairing them with other things. Like if you're having ice cream, you can add some chopped nuts in there. You can also make sure you go on a walk after, or put some peanut butter on top of it. Make sure you're eating that after you eat a meal so you're not hungry while you eat it. If you have some chips, you can add some guacamole to it or cheese sticks to just make it more of a balanced snack. Fast food, you can make sure that you have all the lettuce and tomato and the mushrooms, anything that you can put on it to add the nutrient dense foods. And then if you do have refined carbs like white pasta, you can load it up with protein like a meat sauce, lots of starchy vegetables, and make sure that you are mindful of the portion sizes. So, one of the biggest things for gestational diabetes and diabetes in general, making sure you have a bedtime snack. Isn't that the best thing ever? Is you get to have an excuse. I need to have a snack before I go to bed. So, this actually does help your blood sugars from dropping too low overnight, and it stabilizes your blood sugar in the morning. So having a bedtime snack will really prevent this. But we do want to make sure it's a smart snack, like making sure you have protein, fat, complex carbohydrates, and that you time it right as well. It's not right before you go to bed, but about 30 to 60 minutes before you go to sleep. So, like an example could be a bowl of high protein Greek yogurt with some berries or some toast with almond butter. So, let's debunk a couple of myths as we get close to the end of this webinar. So, a myth could be that I hear a lot is I got gestational diabetes because I ate too much sugar. So, this is a myth because it's not. We haven't found that there is a direct relationship between this. Some people eat a lot of sugar in their pregnancy and they never get it. Some people don't and they still do. So it is gestational diabetes is caused by placental hormones that interfere with your insulin. It's not directly impacted by your diet before or during pregnancy. It is not your fault. Another myth that we talked a little bit about before is I have to cut out all carbs. This, in fact, is dangerous for your baby because they need that to grow, and for you to have that energy is crucial. So remember the power trio of protein, complex carbs, and healthy fats, all three of them together. Another myth that we hear is that if you have gestational diabetes, you will have to have a C-section. It isn't necessarily true. There is slightly higher risk, but a lot of people still have the successful deliveries that they want. And this is why managing it is so important. You can definitely reduce your risk of having the C-section. And another myth is that your baby will be born with diabetes if you have gestational diabetes. And this is not true. It can lead to a higher risk, but it's definitely not true, especially if you manage it pretty well. So you have the power to manage your gestational diabetes and have a healthy pregnancy no matter what. And your healthcare team is here to support you. Just if you haven't heard of these terms, here are the definitions. So you probably have an OB. These are doctors, especially if you're a little higher risk with gestational diabetes, you might be assigned an OB rather than a midwife or a nurse or somebody else for your pregnancy. Registered dietitian, that's what we are here at Mother of Fact. We can help you with your meal plans, with managing your blood sugars through nutrition, making sure you and your baby are healthy. And then a certified diabetes educator, CDE. They have just taken extensive credentialing in diabetes so they can help you with medications, monitoring your blood sugars. And sometimes a nurse or an OB or a RD is a CDE as well. So sometimes they've just extended their education and included more about diabetes. So just so you know, you are not alone. There's many people here to support you, and you can do a great job in managing this. And nutrition is one of the most beneficial, powerful strategies for nourishing yourself and making sure that you reduce risks. And gestational diabetes can feel very overwhelming, but it is manageable and you are capable of managing it. So, and this is an act of love for both yourself and your growing baby. It is hard to do, and we recognize that any changes in your diet or lifestyle are hard to do, but we're here to support you.
Great. Well, thank you so much, Abby. What a wonderful presentation. You covered a lot, and I think that was so helpful and definitely gave some good tips to help those who are navigating potentially, preventing gestational diabetes and or managing. So, people who are here live, please feel free to put any questions in the chat. We do have a little time for a Q&A session. I'll start us off with one that did come through. So, looking at someone that might typically have like a bagel and cream cheese, maybe on their way to work, super quick and easy to eat in the car on the go, asking for some suggestions on what's a better way to kind of give some more blood sugar balance to that breakfast, if you had any tips or ideas.
Yeah, that's a great question. And I want to point out that you're doing a great thing by pairing the carbohydrate with a fat. That's a great way to slow down the glucose spikes. But there are a couple things that you can do to make it a little more beneficial. You can focus on getting more fiber with that meal. So maybe switching out if it's just a white bread bagel, you can switch it out to a whole grain bagel, add some more fiber in there. You could add some berries on top or on the side, or some nuts and seeds on there. You can add some yogurt on the side, or maybe take a protein drink along with you. So it is better than not eating any breakfast at all for sure. And it's not horrible because I feel like you have the fat on there too. So it's not just a carbohydrate that you're eating, but there are some ways, and it depends on you as well. It depends on your likes and what you prefer, how much time you have. So, working with your dietitian can help you make your meals better.
Yeah, I love that tip, especially swapping out for a whole wheat bagel or pairing with some kind of extra protein source on the side. Love it. Also love a good breakfast sandwich option, adding in like a fried egg, some cheese. That could be a good way to add some protein into your handheld. But love that answer, Abby. Another question is how about any tips and suggestions for navigating any kind of sweet sugar cravings, especially at after dinner time, before that bedtime, anything that you find might be most helpful for those who are navigating that? Because I feel like that is something that often does come up in pregnancy.
For sure. And these cravings don't mean that you're a failure, or it doesn't mean that you are unhealthy if you give in to these cravings. You can still do it. And like I said before, I think one of the biggest things in managing these cravings is making sure you're eating enough during the day, because sometimes it gets to the end of the day, you haven't eaten enough, and your body will definitely let you know. So you'll have those cravings. But there are ways you can add a glass of milk with that cookie. You can make that cookie like have some oats in it, or add some raisins or nuts in there. I think that still makes the cookie satisfying, but also it'll fill you up faster and give you more nutrients, manage your blood sugar a little bit more. And making sure, like when you are eating that cookie, you're enjoying it. So you're eating it slowly. You're not just shoving it down and grabbing seven more, that you're chewing it and enjoying it and taking the time to really appreciate it, because that will help you to not eat a lot more and actually enjoy what you're eating.
I love that. So practicing some mindful eating and enjoying and the slower process of eating. So that way you're really taking it in and enjoying that craving that you're having. I love it. And something also I do recommend or see often too is pairing that sweet with your meal. So maybe have it with your dinner and see if that kind of helps a little bit as well when you have maybe a vegetable source, maybe a protein source. That way it kind of completes your meal and might kind of satisfy that craving versus later on in the evening. Great. All right. Well, one final question before we end today's webinar. thoughts on different beverages. So, a question that came in is maybe someone that is typically a soda drinker, and that might be a little bit difficult to either reduce or stop. So, do you have any suggestions to help with that? Maybe a swap, a mocktail idea, any kind of lower sugar beverage options that might switch it up a little bit from just plain water for someone.
Yeah, that's a great question, Shannon, because I just love water. I feel like I never got into drinking other things. So if you have any input after my little thing that I say, just please let me know. But there are other ways. I feel like one of the biggest sources of dietary sugar sometimes comes from these drinks. And so maybe you could add water to it to kind of dilute it a little bit. You can eat it with your meal, like Shannon mentioned, with a cookie to lower the spike of from the blood sugar. There are a lot of options out there with non-sugar sweeteners, and we don't know exactly how that impacts the baby in their pregnancy, but for now it's considered okay. So there's some options out there if you that tastes okay for you. And I mean, you could try like doing a real fruit sweet, like putting real fruit in there, like making your own apple juice, making your own orange juice, because that will have the nutrients as well, more than something that comes from the store, probably. Do you have any other advice, Shannon?
Yeah, I love all those options. I think definitely helpful to overall, look at what you're having and, if we can try to find ways to either make some swaps or reduce overall, that is good. So maybe doing like a seltzer water that has some, natural flavors to it from like real fruits that's not adding any extra sugar and checking your labels on those too. Like I love a good sparkling water. Using some fruit, like you mentioned, to infuse your water if anyone's ever tried like lemon slices, orange slices. Maybe you want to do like a cucumber and mint. So some other things to kind of add some flavor to your beverages that isn't necessarily from sugar. So I think maybe just trying to find, even if it's once in your week, to swap out a soda for a different beverage and to kind of see how you like it. And then maybe you can start to increase it over the course of the week. But great, some great tips. Thank you so much for presenting, Abby. Thank you so much, everyone that has joined us. This will conclude webinar number 3 from our 2026 webinar series.